Hi, I'm Robert Howell, and I will be going over our subgroup's 60-day advocacy action plan. Specifically, our subgroup is responsible for healthcare professionals and organizations. So, in week one, we'd want to develop that 60-day action plan and generate facts and statistics, pull in our information, our SWOT analysis, making sure we have everything that we need moving forward. Then in week two, we'd want to organize a meeting with the three other subgroups to review each other's plan and kind of see the targets of each subgroup, making sure that we're all on the same page. Then in week three, we'd want to gather as many volunteers as possible. The more hands, the better. And that's when we would develop our educational email. So then in week four, we'd email members of the AANA, educating them on the legislation at hand, and push members to contact their current representatives to vote in our favor. Then in week five, we'd want to meet up with the heads of other nursing organizations to be able to send that same educational email out to nurse practitioners across the US. And at the same time, we'd want to create a social media campaign targeted to reach ARNPs, and hopefully those same nursing organizations will be willing to promote our videos and ads. Then in week six, we'd want to set up meetings with local VA hospital directors to educate them on the current situation and gain support. And of course, we'd want to set up phone calls with other directors that are not local. Then in week seven, we'd want to meet with the AANA Government Affairs Division to review our progress, kind of see where we're at, evaluate the current effectiveness of our action plan, and make adjustments if necessary. Then in week eight, we'd want to review our gained supporters and remind them that the vote is a week away, and kind of push them to contact their local legislation again. That way they could vote in our favor.
Hello, my name is Jacqueline O'Connor, and I will be presenting our fact sheet in favor of our proposal allowing CRNAs to practice to the full extent of their education and licensure within the Veterans Health Administration system. This fact sheet will be available during the 60-day public comment period that you will hear about later in our presentation. In order to improve veterans' access to care, we would like to allow the full use of CRNAs in the Veterans Health Administration. Many people might not be aware of what CRNAs are and where they practice, but CRNAs are certified registered nurse anesthetists. They have been administering anesthesia since the Civil War and are the primary anesthesia provider within the military. They are graduate level prepared nurses who are anticipated to obtain even higher levels of education, since the Institute of Medicine report recommended doubling the number of nurses with doctorate degrees by the year 2020. In fact, beginning in 2022, all students enrolling in an accredited CRNA program must be registered in a doctoral program. In order to obtain their licensure, graduates must pass the National Certification Exam, and in order to maintain their status, they are required to take part in the Continued Professional Certification Program, which includes over 100 continuing education credits, 4 core modules, and a performance standard assessment every 8 years. CRNAs work in a variety of healthcare settings where anesthesia is delivered and administer 49 million anesthetics annually each year. They work in a variety of healthcare settings such as hospital surgery suites, ambulatory surgical centers, critical access hospitals, and even obstetrical delivery rooms. They may also practice in outpatient offices such as plastic surgeons, pain management specialists, or even dentists and podiatrists. They also practice within the United States military system, the Public Health Services, and the Department of Veterans Affairs. There's already been legislation which has been modified to allow greater functionality for CRNAs. The Center for Medicaid and Medicare Services modified the federal physician supervision requirement for CRNAs and allowed state governors to elect to not require supervision for facility reimbursement. Since this change was made in 2001, 17 states have opted out, and many additional states have no supervision requirements and are eligible to do so as well. As of right now, 30 states have granted CRNAs independent practice without requiring physician supervision. Our goal is simply to expand veterans' access to healthcare by allowing advanced practice registered nurses, including CRNAs, to practice the full extent of their education and licensure. This would benefit veterans by giving them greater access for surgical care. It would decrease their wait times for the receipt of that care, and it would allow veterans the opportunity to receive the high quality care that they deserve. It would also benefit the Veterans Health Administration because it's more cost effective to use CRNAs than anesthesiologists, and it would allow the VA to utilize the over 900 CRNAs that are already practicing in the VA facilities. Furthermore, there's already an existing precedent within the Veterans Affairs system. This allows other specialty nurses, such as clinical nurse specialists, certified nurse midwives, and certified nurse practitioners, to practice the full extent of their scope. So why not include CRNAs in that group? Thank you.
Hello, my name is Crystal Sanchez, and I'm going to be presenting the projected timeline of activities. So for week 1, we plan to share our advocacy plan and meet with state associates to present the projected action plan. During our week 2, we plan to organize an AANA teletown hall meeting in order to educate the public on the role of the CRNA and to show how the VA would benefit from receiving anesthetic services. During week 3, we plan to promote changes by marketing our fact sheet on social media outlets and raising awareness through our marketing strategies. Week 4, we plan to gather speakers of the AANA to present on behalf of the CRNA profession to our supporters in order to get more information out and continue to advocate for the positions of our profession. And week 5, we plan to contact Florida's AANA state representatives. We will contact nursing organizations to promote ads, education, and videos, again, just to continue to promote, continue to spread our information out there. Week 6, we plan to get AANA outreach to non-AANA members in order to join the AANA and to meet with VA hospital directors. Week 7, we plan to send a final public state association comments, make final changes to the action plan, and get the public comment out. And lastly, on week 8, we plan to submit the final AANA advocacy action plan and as well remind the GAIN supporters in who have joined about voting dates and voting locations to make sure we get our initiative out there.
Dear Government Affairs Director of AANA, the AANA Gold Group is participating in an action plan for Veteran Affairs, or VA, and Advanced Registered Nurse Practitioners, or ARNPs. The purpose of this letter is to address and support the group's proposed advocacy plan. We have created a time frame and a thorough advocacy action plan that would allow achievable results in 60 days. The AANA Gold Group agree with expanding the veterans' access to healthcare by allowing ARNPs the authority to practice within their fullest extent and within their scope. Additionally, certified registered nurse anesthetists, or CRNAs, have been administering anesthesia successfully for over 150 years. However, in some states such as Florida, they do not practice independently, unlike anesthesiologists. By allowing CRNAs to practice to their highest capacity and independently, veterans will have greater access to health care, as well as decrease wait times to the high quality of care that they deserve. The AANA Gold Group are in support of this proposed rule for the state of Florida to become an opt-out state and allow CRNAs to practice independently and without the supervision of an anesthesiologist. Thank you so much for your time and consideration. Sincerely, the AANA Gold Group.
Hi, my name is Daniel Wahlberg, and I'm going to be addressing the 5 frequently asked questions as it relates to CRNAs practicing to the fullest extent of their education and training within the VA system. Question number 1. What is the advocacy goal of CRNAs as it relates to the Department of Veteran Affairs, or the VA system? CRNAs are strongly advocating for immediate full practice authority within the VA system, which employs approximately 900 CRNAs. Question number 2. Why should the VA system allow CRNAs to practice to the fullest extent of their training? Well, there's a handful of reasons. Certified registered nurse anesthetists are more cost-effective when compared to anesthesiologists. Studies have shown no complication or death rate increases when anesthesia services were performed by CRNAs compared to anesthesiologists. As of April 2017, a precedent already exists within the VA system that allows for other specialty nurses to practice to the full extent of their licenses. This includes certified nurse practitioners, clinical nurse specialists, and certified nurse midwives. Nurses have also successfully administered anesthesia since the Civil War in the United States, and CRNAs are the primary anesthesia providers in the United States military today. Utilizing CRNAs to the fullest scope of their practice will allow the United States military and its members to receive high quality and timely care. Question number 3. What type of education and training do CRNAs have? Well, a minimum of about 7 to 8 years of education, training, and experience, which includes a nursing degree from a nationally accredited program, hands-on critical care nursing experience. As a student registered nurse anesthetist, you complete about 2,500 clinical hours and administer approximately 850 anesthetics. Completion of a master's or doctorate degree in anesthesia. And finally, CRNAs must be board certified to practice with recertification every 2 years. Question 4, will the anesthesia care change depending if the practitioner is an anesthesiologist or a CRNA? The answer is no. The process of administering anesthesia care is the same regardless if an anesthesiologist or a CRNA is the provider. And this is for all types of procedures. The same techniques and safety measures are applied across the board. Finally, who else is supporting CRNA full practice authority within the VA system? Well, there are over 75 members of Congress, 53 nursing organizations, including the American Association of Nurse Anesthetists and the Association of Veteran Affairs Nurse Anesthetists. There are various veteran groups and associations, including the Military Officers Association of America, the Air Force Sergeants Association, and finally, the AARP. Thank you for your time, and together, let's see positive change.